I always ask the question, would I take it? Would you give it to your wife with a bad head? And the answer is absolutely, definitely not.
She shouldn't be dead, she wouldn't be dead only for the drug, and she just shouldn't have died.
We were the guinea pigs, that's how I feel. It was like a live drug trial.
At what stage do you say this should be withdrawn from the market? How many people have to die?
In May this year, Nimesulide, a popularly prescribed painkiller known as Olin or Mesulid, used by about 40,000 people every month, was taken off the shelves. By the time the Irish Medicines Board took this action, there were 6 deaths linked to the drug, 6 other cases of liver failure, and almost 150 reports of negative side effects. Tonight, Primetime investigates just how difficult it is for a drug to be taken off the market, even when there's mounting evidence that patients are suffering toxic side effects. Does patient safety come first? We look at what happened in the case of Olin and how, despite warnings, increasing numbers of patients were being prescribed the drug and being put at risk. It was the inquest into the tragic death of Waterford woman Joan Flavin, who died after taking Nimesulide, which brought the drug to national attention. Her family recall how she went downhill after taking the drug for arthritis.
She wasn't feeling right, and she went to the doctor, and he diagnosed her as having pleurisy, and that was about 2 months before she became very unwell. She went back again, and the doctor was on holidays. So she met the locum, and he thought that she had either irritable bowel or gallstones.
But Joan herself worried that the drug which she was taking over 8 months was making her very ill.
She did think it was the medication, and she said, all the time when she was feeling unwell, she was poisoning herself. She did say to us on a number of occasions, she said, "I'm being poisoned."
When Joan was eventually admitted to hospital, doctors there recognised that she was having a bad reaction to the drug.
She met one doctor in accident and emergency, wherever she'd went into that day, and he saw the drug and he said that she shouldn't have been on it.
A biopsy established that the drug had a toxic effect on her liver. Joan fought bravely, but her decline was rapid.
I asked her once, how she felt. I said, "Do you feel bitter?" And she said, "Well, not at the moment," she said, "but maybe if I'll get better, maybe I will." Because she knew it was the tablet that did this to her, just the medicine. She knew that.
It was horrific, and I would hate to see somebody having to go through that just because of a medication she was having for just a simple pain. But for something to do this, it wasn't right, not to Mum.
Shortly before an inquest into Joan's death, at which the Irish Medicines Board were asked to give evidence, they suspended the drug from the market. The timing of their action raised questions with the family.
We felt, Mother's case was sort of a high-profile case. It got a lot of publicity, and, we did feel that it must have had some connection with it being taken off the market.
What the family didn't know at the time was that they were not the first Irish family to lose a loved one because of this drug. By the time of Joan Flavin's inquest, the people who are there to protect us from harmful medicines, the Irish Medicines Board, knew of 4 other suspected deaths, 6 liver transplantation cases, and had over 50 reports of bad side effects to the liver. Crucially, they had privately declared this drug to be unsafe in 2003, and yet it continued to be prescribed, continued to be taken, and continued to harm until it was finally pulled from the market earlier this year. That's something the Flavin family can't understand.
Now when we think of it and see that other people had died beforehand and that still nothing was done about it, you get quite angry. It's very disappointing, like we're left without a mother, our children without their grandmother, and, it's lonely time. Just for a drug. She shouldn't be dead, she wouldn't be dead only for the drug, and she just shouldn't have died.
So how was it that this medicine was on the market here for 12 years, despite mounting evidence that it was dangerous and that people were dying after taking it? The answer to that question raises serious questions about the system the Irish Medicines Board has to safeguard the public from the rare but sometimes devastating consequences of the drugs we buy in the local pharmacy. The importance of drug safety has been recognised since the 1960s, when the notorious drug thalidomide caused severe disabilities in children all over the world. In Ireland, the National Drugs Advisory Board was set up to ensure that only safe drugs were on the market. Having an effective medicines agency was vital because it was our main defence against a harmful drug ending up in our pharmacies and our medicine cabinets. It was to this agency in 1995 that a Swiss company, Helsinn Birex, with a manufacturing base in Dublin, applied for permission to launch a painkiller on the Irish market, Nimesulide, which had become commonly known as Mesulid or Olin. It's an anti-inflammatory, and anti-inflammatories were known to be potentially toxic to people's livers. Brian Leonard was a member of the National Drugs Advisory Board at the time. He told us that although a decision was taken to allow Olin onto the market, it was considered essential that it only be allowed for short-term use.
At the time, the chairman of the board, Professor Graham Shaw, was concerned about some of the toxicity evidence which was in fact coming from the UK at that time, and raised this with the board. We looked at this very, very carefully. We asked for additional information from the company in terms of particularly the safety as well as efficacy, and we decided that on balance that there might be some advantage of actually introducing the drug to the Irish market on the firm understanding that not only the dose but also the duration for which it could be used was going to be very, very carefully controlled.
There had been a concern about this group of drugs, and there still is, with causing liver problems. And it goes back to a drug called Oprin in the 1980s in the United Kingdom. Particularly it affected older women, and they got liver problems and a large number of deaths.
It was after the experience with this anti-inflammatory drug that regulatory rules changed in some of the world's leading markets, such as the US and the UK. Nimesulide was never licensed in these places. But once launched here, it was aggressively marketed. In correspondence seen by Primetime, it's clear that our Drugs Advisory Board were unhappy about the nature of that marketing. Helsinn were instructed by the board to refrain from making false claims about the drug's supposedly unique properties. It was a powerful painkiller, but the company's claim that it was easier on the stomach than other anti-inflammatories was later scientifically disproved. Concerns about the drug led a number of hospitals such as Cork University Hospital, Kerry General and the Adelaide in Dublin not to approve its use. Within a year, there was the first major indication that the drug was severely liver toxic for some people, particularly older women. Betty Kellett from Dunamead in Dublin took Olin over a period of months for lower back pain in 1996, but began to feel sick because of it.
She wouldn't have been one to take to the bed, so we actually had a christening. My first child was being christened on the Sunday after she had become unwell. So she tried her best. She stayed up, she did a bit of housework, and she came to the christening. She was quite jaundiced at that stage. During the following week then, she steadily got worse, and towards the weekend then she would have been in bed. And again, that would have been very unlike her, and we were actually very, very concerned about her.
Betty Kellett had to be hospitalised and underwent tests, but it was clear to the family that the hospital staff were unsure as to the cause of her condition.
They were wondering what exactly she had been taking. They had asked us quite a lot of questions about her, and because it was the liver, they obviously had to ask about alcohol use.